Now, without any further delay, let's begin today's event, hosted by Employee Benefit News and sponsored by LIMEADE. It is my pleasure to introduce your moderator for today, and that is Lynn Gresham. Lynn, you have the floor.
Thank you, Jessica. Good day, everyone. We're pleased to have you with us for this web seminar, How Kindred Healthcare Improves the Whole Employee Through a Single Platform. I'm Lynn Gresham, contributing editor with Employee Benefit News and Employee Benefit Advisor. Today you'll hear from two HR benefits experts, Stephen Parker of LIMEADE and Cheryl Pretty from Kindred Healthcare, on why taking a whole person approach is essential for improving employee well-being and engagement, and how to deliver a highly personalized message. I'd like to tell you a bit more about them now. Stephen Parker is the Vice President of Customer Success at LIMEADE, an employee engagement company that inspires commitment by elevating culture. Stephen leads the LIMEADE Customer Success team in pre-sales support, consulting strategy, and program design. He brings over 20 years of experience from companies including Achievers, SumTotal Systems, Oracle, AAA, and the U.S. Army Special Operations. Sharing our virtual stage with Stephen is Cheryl Pretty, Division Vice President for Benefits at Kindred Healthcare in Louisville, Kentucky. Kindred is the largest post-acute care provider in the country with more than 100,000 employees working from hospitals, rehab centers, and patient homes. Cheryl has been with Kindred for 20 years and has extensive experience in all aspects of benefits administration and communication. She's been working with LIMEADE since the beginning of their partnership. Welcome to you both. Stephen, I'll now turn the program over to you.
Thanks, Lynn, and thanks, Cheryl. I'll take us through the agenda today, and I have to say I'm really excited for this webinar because this is truly the story of a great company, Kindred Healthcare, and I think you'll find that Cheryl and her team have done a lot to make it that way. So I'm going to share with you the recipe for building a great company, and then I'll turn it over to Cheryl, and she'll introduce Kindred Healthcare, talk about how they authentically invest in their people with their Healthy Steps Wellness program. She'll discuss connecting their people who are frankly dispersed all over the country to their whole ecosystem by using integrations. And she'll finally share how that's helped them be a great company and the results that they've achieved. So without further ado, let's talk about building great companies, which is a great thing, I think, to talk about any day of the week. And as you can bet from the introduction, well-being matters a lot to us at LIMEADE and to Kindred Healthcare. And that's because we know that well-being and employee engagement are virtually impossible to separate. Most human beings really, they evaluate their relationship with their organization kind of the same way that they think about relationships with other people. They want to feel safe and secure. They want to be challenged. They want to have fun. And maybe most of all, they want to be cared for. So when your organization can prove to them that you care for them by authentically investing in them and their well-being, they will authentically invest in you, which is really what employee engagement is all about. And I'll talk about some of the results that we've seen in our most recent study with the Quantum Workplace around how connected these things are. So on the left hand of the chart, you see those people who had higher well-being. On the right hand, you see those people who had lower well-being. And starting from the bottom, recommending as a great place to work, 36% more in the higher well-being category would recommend their place as a great place to work. 30% more loyal to their teams, over 40% more enjoy their work, and probably the most important factor here, 38% more feel engaged at work. So let's talk about what that means. I think employee engagement has been talked about for a long time now, ever since I got into HR 20 years ago. And so we know from numerous sources that highly engaged employees can drive better business results. A lot of different consultancies have connected those two things. You can see here again some of the stats, 2.5x the stock price growth in organizations with highly engaged employees. Organizations with highly engaged employees are 78% more profitable and 40% more productive. And then they have a better work environment too, things like 5 times less likely to have safety incidences. But I think maybe the most important finding is one that Aon came up with several years ago, which states that for every 1% increase in employee engagement, organizations can expect a 0.6% increase in revenue. So that means for the average Fortune 500 company, every 1% of employee engagement is worth $150 million to your top line. So huge opportunity when we authentically invest in our people to drive real business results and help build a great company. Essentially, that's what this model shows. So many organizations are still struggling with superficial wellness programs that, frankly, people usually only do because they have to, and they'll do to the bare minimum required. Or worse, some have even punitive programs that feel invasive and can actually disengage employees, which is not a good outcome by any means. So when you look at employee engagement, we're still spending about $400 per employee just to measure employee engagement with no real improvement for the last 10 years. It's unfortunate because I think the equation is really this simple. When you authentically invest in your people, when you approach engagement through the lens of well-being, you can help your company inspire commitment, mutual commitment between the company and your people, and elevate your culture. And when you are authentically investing in well-being and driving employee engagement, you have better business results and can build a great company. That's really all there is to it. Now, easier said than done in some organizations. In order for it really to work, well-being efforts have to be immersive. What do I mean by immersive? First, we need to consider the whole person. Most of you have probably heard this already, so I'm probably speaking to the choir on this one. We know that we shouldn't just pay attention to the physical issues that show up directly in claims and make it harder to manage the benefits organization, but we actually need to provide support for our people to improve physical, emotional, financial, and work well-being, because all those things are interconnected, and what happens in one area can impact the other area. For example, maybe the reason I'm overeating is because I'm overworked and I'm a single mom, and on my way home I grab McDonald's so that I can feed my kids and get into bed on time. Or maybe the reason I'm smoking is because I'm going through a divorce. So, like I said, probably preaching to the choir when we talk about whole person well-being. But I think the next area might be news to a lot of organizations, and that is we also have to think about the environment that whole person is in when they're with us, the whole company. So, imagine being as physically fit as you could possibly be, but coming to work every day and not getting along with your coworkers or your boss. You're not going to feel that level of mutual commitment that will drive real employee engagement and help you build a great company. So focusing on the individual isn't enough. There are other elements that can help or hinder that development of mutual commitment, and we have to surround and immerse our people with the support they need across the whole company, and we call that concept organizational support. And that includes things like connecting with leaders and managers and helping them understand how important it is to take care of their people and invest in them. It even goes down to peers and social networks and enabling those, and maybe even all the way down to the physical environment that we put people in. And then even surrounding all of that are all the tools and technologies and opportunities that we allow our folks to participate in our whole ecosystem. So we have to connect employees to that whole ecosystem in a way where they have access to all those tools and support available to them, but they aren't paralyzed by all the things that they could do. In fact, a lot of organizations struggle with this problem. They offer so many different benefits and opportunities for their employees that their employees end up not using any of them because it's overwhelming. People don't want to see all the things that they could do. They want to just have access to those few things that they should do just in time and in the moment. And that's really why we're seeing the beginning of an important evolution in HR technology. We're seeing HR technology evolve away from technology that just automates processes and provides insight into something that people use because they want to, not because they have to. And this is a really important point. Think about all the technology and tools that you provide to your people in your organization. If you took any of them away, would people actually go and sign up for a personal license for those tools because they really feel it makes a difference for them? If the answer is no, you probably haven't hit that sweet spot of real employee adoption. And you might have people just using things because they're told to. more specifically, we're seeing some very important areas combined that help drive value for the employee. Those areas are well-being, obviously, and that enables us to focus on not just measuring what's going on from an HR standpoint, but actually helping people take action and building stronger physical, emotional, financial, and work habits. But then also we're combining that with social recognition that allows employees and leaders to catch people doing things right and, frankly, broadcast that in a way where what gets recognized publicly gets repeated. So people learn, like, oh, these are the types of behaviors that are going to lead to my success. Combine that with engagement solutions, and you start to create energy and esprit de corps and sense of purpose and elevate culture like I talked about before. And then finally, and maybe the most sort of technically geeky, if you will, is this concept of aggregation, where we can actually increase the value of your investments by leveraging every company capability and program. So let me just talk about that one more slide, and then I'll turn it over to Cheryl. Basically, this slide can be, frankly, what a lot of your employees experience when they experience you and your benefits in your organization. They can experience being overwhelmed. You take a look at this slide and you don't really know what you're looking at because you have so many different partners in your organization that can help improve well-being and engagement. You also have what goes on in your organization outside of your space, your culture, how people are interacting with their peers and their bosses, et cetera. And then LIMEADE and the other well-being providers have content libraries of great activities that your employees can also perform in order to improve their well-being and engagement. And then finally, maybe you're introducing new partners on a regular basis. And all this can be, like I said before, paralyzing unless you use technology to help cut through the clutter and start to get smart and recommend those things to employees that may add a lot of value to them in the situation that they're in right in the moment. And that's what we call aggregation. So with that, I want to introduce to you the Kindred story. And Kindred Healthcare has partnered with LIMEADE for a long time now. In fact, Cheryl has been there, like Lynn said, since the beginning, and it's helped Kindred build a really great program. Kindred people have completed over 2 million activities in the last 6 years that we've partnered with them to help improve their well-being and engagement. And consequently, Kindred has been named one of Fortune's most admired healthcare companies for 8 years in a row. More importantly, I consider Cheryl a friend. She has an awesome story to tell you about how Kindred is building a great company, and I will turn it over to her. Cheryl.
All right. Thank you, Stephen. Good afternoon, everyone. Before we get started on our program, let's just take a minute. I want to talk about Kindred Healthcare and who we are. As was said earlier in the presentation, we are the largest post-acute care provider in the United States. We have employees located across 45 states in 2,500 locations and about 88,000 employees, with over 80% of that population being female. Our employees provide care in hospital and rehab settings as well as home care and hospice. And about half our population is mobile, so they're not going to the same brick and mortar site each day, which makes communicating effectively and building engagement very challenging with that type of population. So what we know from being in healthcare, and probably no surprise to anyone who is part of a healthcare company, is that it's very common for caretakers to forget about their own well-being, whether it's their physical well-being or things like preventive care or their emotional and mental well-being that includes taking that me time that they may need. Healthcare can be physically draining, but it's also emotionally and mentally draining, and especially true here at Kindred because we do have a very large hospice population. And because of this, we want a program that supports the whole employee. And we started our journey into wellness back in 2005, and since that time it's really been kind of touch and go to figure out what works and what doesn't. Creating the right wellness program doesn't happen overnight. We've definitely learned that, and it took us many years to figure out what the right approach was. As I said, back in 2005, that was our very first wellness program, and at that time, we branded our program as Healthy Steps Wellness, and we have kept that branding throughout the years. And in that very first year of wellness, we asked employees to simply complete a well-being assessment, and they received a gift card for doing so. So that was kind of just that first step to see, how employees would react. From there, we incorporated some coaching, and then about 6 years ago, we began our partnership with LIMEADE, and that's really when our program took off. Today's program, in the simplest of terms, is comprised of 3 steps. We have our well-being assessment, our biometric screening, and then various activities that our population does for points. And those 3 components apply to all participants in the program, but what's really great about it is that employees are able to personalize their experience and create the program that works for them. And I really think it's this personalization that's resulting in about 70% of our eligible employees and spouses to participate year over year. So I'm very proud that we've been able to sustain that engagement each year. So we have this fantastic program in place, and we have a lot of tools available to employees, but how do we support well-being as a company? And I think it's a combination of a few things. Some of it's happened organically, simply by having some form of a wellness program in place since 2005. I think it's just become part of the culture here at Kindred. People know that we have wellness. It's expected. But over the years, we've also seen leaders begin to embrace it. We see a lot of walking meetings happening in various departments and leadership in various areas, whether it's workers' comp, compliance, safety. They come to us as a way to partner because they want to put activities related to their programs on the platform as a way to partner and a way to get attention, because people do go out to the platform regularly and they do pay attention to what's out there. But most importantly, we've been able to use the platform to target participants and reach the right people at the right time, which, again, to me is the most important aspect. So we do have some employees in brick-and-mortar locations, in our hospitals and our corporate office, for example. And for that population, we've been able to focus on the physical environment. We offer weekly farmers markets. We've had annual wellness fairs, mobile mammography units, and more. We're also in the process of rolling out our first on-site health clinic in a partnership with Johns Hopkins, and we are extremely excited about it. And our hope is to roll out more on-site clinics in areas of the country where we have large concentrations of employees. So anytime we're able to do these things, whether it's as simple as, the weekly farmers market or anything of that nature, we always remind employees that these are brought to them through their Healthy Steps Wellness program. We think it's very important to remind employees that the program is not just about the activities and the points, but we want to sustain year-round engagement and interest in the wellness program. So we found that that's been a very effective way to do it. But most of our employees aren't in those brick-and-mortar locations, and it's really hard to reach employees who spend the better part of their workday in a patient home or in their car driving from various sites of care. And in those situations, the employee can feel very disconnected from Kindred and their coworkers. Sometimes some of our population may not see other coworkers, they may not see their manager, and they're not going into a Kindred building each day. So it's very easy to feel disconnected. And luckily, we've had a few different opportunities to address this. One is through local activities, and we've set up those types of challenges at a local level when we've had, for example, a local cause at a particular area in the country. And so we'll set up a challenge for a specific site. We've also set up various team challenges. We've had stairway wars where teams of 4 to 12 people tracked flights of stairs, healthy snacks challenges where various teams shared healthy snack ideas. And then we do offer coaching, which includes telephonic and web-based options, and it also can be done individually or as a group, so another way for people to feel connected. I think the important thing around all these options is to remember that employees can engage anywhere because the platform is available on any mobile device, and there is an app as well. So you're never too far from being able to engage anytime that you wish to do so. So one of my favorite ways we've engaged those who are hard to reach is through our annual company-wide challenge called Move Across America. And we created this challenge several years ago, and it occurs over 6 weeks. It's every year over a 6-week period in late spring, early summer, and it's set up so that our employees compete by state. Employees are told the number of steps we've collectively taken as an organization each week and where those steps have taken them by tying it to a Kindred site. So, for example, we may start this 6-week kickoff at, a site. On the platform, we'll be at a site called, our hospice and home care office in Massachusetts. And then at the first week, we'll see how many steps we've collectively taken and tell employees, we've taken enough steps together that now we're at a Kindred hospital in Tennessee. And as we reach a site through our steps, we highlight that particular work location with fun facts provided by local leadership. And it allows employees to feel connected to one another. If you work in California, for example, you're learning about a hospital in Tennessee and what the employees there enjoy doing for fun and so forth. We also created a hashtag when we rolled this out a few years ago so employees can post things on social media. Hashtag Kindred Moves, and it's really fun to go out there and see the posts related to people, with their physical activity. We've seen hula hoop groups. We've had people who do marathons, people who are gardening, who are at the park with their kids. So it's just really fun to see the variety of things that get posted out there. And again, it really does create a connection across our lines of business and various sites of service. So we've talked about some of the things that have worked year over year to make our program successful. But to continue with that success, we know we're going to need a way to test various vendors and solutions to really see what works for us. And luckily with LIMEADE, we're able to do that. So what you're seeing here is just the overall well-being ecosystem here at Kindred. And we've invested in a wide range of resources for different employee needs. We definitely know it's not a one-size-fits-all, and we rely on LIMEADE and the platform to reach our employees. Whether the focus is biometrics, nutrition, financial, we consider any resource that can help improve well-being, and we're constantly looking for additional resources for our employees. Some resources that we offer are on an ongoing basis and have proven to be successful year over year. For example, we offer the Mercer Health Advantage program for disease management and Aduro Health Coaching. Those have been in play over the years of our partnership, and we found success and they stay in place. But others we look for on a pilot basis. We roll them out. We see what sticks and what doesn't. For example, this year we rolled out Smart Dollar, which focuses on financial well-being. For the initial pilot, it was offered to a very small population, and we relied on the platform to serve up the option to a very limited employee population based on their worksite location. We've had pretty high employee interest, and we've seen some good outcomes with the program, so we are planning to continue to offer it next year to an even broader population. And as we continue into next year, LIMEADE will use the data from the financial dimension of the well-being assessment to target those employees who will benefit most. So while that was a successful pilot, we've had a few others that weren't as successful. For example, this year we rolled out a couple of nutrition pilots, and we did not have very high utilization. And so we'll continue to review and refine those offerings, and most likely in the coming year look for new options to offer. So it really is just a continuous process to find the right combination of solutions. You have to figure out what works and what doesn't work for your employees. And for Kindred, the end goal is always providing our employees with a personalized experience. We know the program works best when we're able to serve up what the employees need. So as we think about the personalized experience we want for our employees, I'd like to share one of our employees' journeys. This particular employee had a medical procedure, and she didn't have the recovery she expected. The recovery took much longer, and it proved to be pretty difficult for her. And as a result, she gained a significant amount of weight, and she was diagnosed with diabetes. During that time, she turned to the Healthy Steps Wellness Program for resources, and she started to begin to pay attention to her calories. She was watching what she was consuming, what she was burning, and so forth. And within our wellness program, she discovered Livongo, which was a pilot we offered this year, and it focused on diabetes management. And with the program, she was able to check her blood sugars daily, and it allowed her to see which foods were impacting her glucose levels. She lost 103 pounds, which is just so fantastic, and reduced her A1C from 8.7 to 5.5. And here's a quote from that employee: "If you look at the challenges that the Healthy Steps program picks for you based on your own interests, it can help you target and pinpoint goals to improve overall health and well-being." And it just really does show the value provided when you create a personalized program for your employees. So we've talked about the program, what we found to work for us, and sometimes what doesn't work for us. But how do we measure success? And, you can measure success in various ways. And for me, success has come somewhat from just the culture shift that I've seen and the employee stories like the one I just shared. It's been very exciting through the years. I have been here since 2005, so I've seen the journey our wellness program has taken us on. So it's been very exciting to see people embrace the concept of well-being. It's fun to be in the halls and hear people discuss their points or which activities they're taking part in, or even people comparing their biometric screening results, things that you wouldn't have heard people talk about without a wellness program and without the excitement that we've been able to build. But we know numbers are still important, and we do have to validate the success of the program with numbers if we want to continue to make the investment. So what are our numbers telling us? Well, we're seeing some really, really good stuff. We took, based on a 3-year cohort from 2013 to 2015, and here's what we've seen. We've seen that 25% of our population improved their overall health. Our overweight employees with program participation improved their risk level by 24%. 60% of those in the coaching program improved in at least one health risk. And in 2016, we saw that number increase to even 70% of our coaching participants improve. And then participating employees improved 100% of their well-being dimensions. So just a phenomenal story when we look at it. In addition to those numbers, we're also always paying very close attention, like all companies, to our turnover and what we can do to reduce turnover. And we've taken a look at turnover as it relates to participation in the wellness program. And for 2016, we found that employees who participate in 5 or more activities have less than half the turnover of those who don't. And those heavy utilizers of the program, which we define as employees who participate in 10 or more challenges, they turn over even less. So this definitely tells us that we have to find more ways to keep our employees engaged year-round and provide those ongoing opportunities for improvement, because there's definitely value in it. And with that, I'm going to turn it back over to Stephen.
Thanks, Cheryl. I love your story, and I love how you have graduated your measurement away from just program type of measurement into understanding really how the program is impacting your organization. And I think, when I think back to when I first started in benefits many years ago, it was exciting because we realized that we were in the business of really creating a great environment where we could, keep and hire great people to do great things. And I think that's what Kindred's been able to do in, frankly, some hard conditions, right? Caregivers tend to not think of themselves first. They think of others. You've got a very dispersed workforce. It's got to be tough. And I love that you're taking these program results and correlating them to things that are going to be important to the folks who are running the business, like turnover, like employee engagement. And that's exactly the point of our great company model. Again, when you invest in the well-being of your folks, it drives real employee engagement. As long as you do it authentically, you'll see outstanding business results and be a great company like Kindred. And so we have something that can help you guys, those of you who are thinking, well, how do I do that in my organization? The things that we care about are maybe a little bit different than what Kindred cares about. If you follow this model, we call it the LIMEADE results model. And don't just stop with sort of the basic level stats, how many people are using these sets of tools, this program, do they like it? I mean, that's important, but that's just sort of table stakes. The next thing you should think about are people actually improving their habits? Are they learning new ways to behave that will help them be more successful in life and at work? And then, is that actually positively impacting their well-being? And not just a small set of the population who might be struggling with diseases, but actually everybody. Are we proving to our employees that we're authentically investing in all of them? and helping them all be better. And then finally, those impacts start to show up in people metrics like turnover and engagement and business metrics. I know with Kindred, we're going to start focusing on tying higher well-being scores to what happens with the patients. We suspect that folks who have higher well-being and are more engaged in their work are going to have better patient care satisfaction results, and we're going to start taking a look at that. For your organization, that might be things like same-store sales or something else. But we highly encourage you to think all the way through these 5 steps to really prove the value of your efforts and frankly get back to what made us all excited to be in benefits in the first place, which is, impacting the organization on an environmental level and not just at a cost level. So with that, we're going to get into Q&A, and I'm going to kind of break the rule a little bit just because I haven't broken any rules for the last 40 minutes, so I feel the need to. I'm going to ask the first question, but then Lynn, our moderator, is going to help us ask some questions. But Cheryl, it struck me when you were talking about how you've been able to experiment with different programs, through your wellness platform. It struck me that, some of the folks on this call might be a one-person benefits department. And I was wondering how hard it was or not for you to bring in new vendors, expose them to your employees across the United States, and make decisions on whether or not they were working. Can you talk a little bit more about that process?
Sure, yeah. I think the hardest part of always picking new vendors and trying to figure out what works is just kind of the vetting process with the vendor. We've all been there where you have various meetings and it's the sales team that comes in and they tell you what you want to hear and you're hopeful that things will work and so forth and you kind of pick and hope that works. That's probably the most challenging as far as once we've made decisions on who we want to partner with and how we want it to work. It's definitely worked very easy as far as building that integration on the platform and having it be a seamless process on our end and on part of the employee. So I think the hardest part comes probably long before LIMEADE's even involved. But once we're able to figure out who we want to work with and how we want it to work, from there it's a very easy process.
Awesome. So, Lynn, I promised to only break the rule once. I'm going to turn it over to you. I know we have some questions teed up from our attendees for Cheryl as well.
Yes, we do, Stephen. Thanks very much. And the first one in queue is, have you seen any impact on underutilized programs once you integrate with the LIMEADE platform?
Yeah, we actually have. So one of the things we did, we had very low participation in our telemedicine program. And so, it's a resource that's out there for employees, but it's just not something that we've seen employees really engage in and take part in, or a lot of times even be aware that it exists. And so, one thing to note, too, is that our telemedicine, we're a multi-vendor approach for medical, and so we have Anthem, Aetna, and United Healthcare at play at different areas of the country. And so our telemed is baked into each of these 3 programs. And so we worked with LIMEADE to set up tiles within the platform to promote the teledoc program. So we had to do a couple things. We had to make sure, first of all, that the tile an employee saw was the right program. So if you have Aetna, you saw their telemed program. If you had Anthem, you saw theirs, and so forth. And then kind of how to tee it up and get people to pay attention. And so we did that, and what we were able to find, we actually saw our registrations for the telemedicine program increase by 400%. So it definitely works when you can promote it and you can get it out there. And again, it was back to that personalized experience because it was based on which healthcare vendor that an employee had.
That's great. Stephen, do you have any other comments to add to that?
No, I think Cheryl did it perfectly.
Okay, the next question is, when you talk about turnover, are you talking about in the well-being program or in terms of staff headcount?
That is based on staff headcount, not turnover within the program. So for anything that we look at within the program, we're looking at a cohort group of who's participated in the wellness program year over year. And so the turnover is based on if you're actively in the wellness program versus as an employee, or you're an employee who's no longer with Kindred.
Okay, yeah, thanks, Cheryl.
And I think the important information there was the ability to say people who are participating more in the things that Kindred are offering are actually starting to feel a bigger connection or more mutual commitment with Kindred, and that's showing up by them leaving less. And I think that's a really powerful statement that, frankly, CHROs and business leaders really tend to care about, to be able to say, hey, it's working. So good work, Cheryl.
Next question is, can you give us a sense of what participants can redeem with their points, as well as the maximum number of points that can be earned?
Yeah, sure. So we're still kind of figuring out where we're going to take our point system, but for now, for Kindred, we have a couple things. So over the course of the program year, if you earn 2,200 points, you for the entire plan year receive a reduction on your health insurance premium. If you're an employee who covers only yourself or yourself and your children, it's $75 a month less. And then if you cover a spouse or a partner, it's $200 less a month that you pay if you engage in the wellness program and you get your points. Then beyond that, we call them kind of our overachievers. If you go up to 3,500 points over the course of the plan year, then you're eligible for a drawing. And for the past couple years, we've given away $1,000 Amazon gift cards. I think about 30 of those is what we've drawn for. And so, for some people, that's really important. We have looked at a few other options. We just haven't moved there yet. So for now, our points are really related to, for the most part, it's tied to your medical premium. And then, like I said, for those overachievers, people who really want to keep going and get more than just that, they're entered into the drawing.
Yeah, and Cheryl, I think you and I have talked about something that's probably maybe even more important than the extrinsic motivators that your organization provides, and that's the fact that it's become ingrained in your culture. People are starting to kind of create a community or coalesce around a community. You mentioned people talk about their biometrics in the hallway, which can be which can scare some of the people on this call. But tell us about that. How did you guys? What is life like at Kindred when it comes to well-being? How do you keep this top of mind? Is it about the incentives or is it about something else?
We definitely know the incentives play a role in it, but I do think it has become part of the culture, and it is, we joke that it's, like paying taxes and the old saying that certain things you have to do in life, and they do. They have accepted it, I would say, came a few years ago, and now people actually do talk about it. It's really fun to hear people comparing their points. Well, how did you already get your points? Well, how did you get more points than me? And one of my favorite stories is my team one year we had an activity around smiling, and everyone did it, and they would not stop smiling, and it was just a really odd experience. When everyone smiles all the time, it's a little unnatural. But people do enjoy those kinds of things. As far as the biometrics in the hallway, when we started the program in 2005, and even probably for the first couple of years following that, people were really paranoid. People were really worried that, what are you going to do with this information? Are you going to share this information? Are you going to use it against me later and not promote me? How honest should I be on my well-being assessment? What else are you testing me for when you draw my blood? Things like that. But part of that's been just through walking the walk and proving to people that we're not looking at their information. We're not using their information. We don't know their scores. It's provided back to them through the platform, and it really is theirs to share with their, friends and coworkers if they want to, but it's certainly not anything that's expected, and no one's, required to share anything that they don't want to. So I think it's come with trust, and it really is about feeling like, that personal experience that's served up to employees, it's so non-invasive. I don't think most employees realize the program is so personalized. It's done with such a soft touch that they don't even know that I'm only seeing these things because I answered this question this way, or my biometric screening showed I need this, but my coworkers aren't seeing this. So I think that plays a very big role in it not feeling creepy.
That's awesome. Hey, Lynn, I'm noticing.
Yes?
I love the fact that we have a lot of tactical and practical questions queued up. We might do kind of a lightning round for some of these questions. A lot of folks look like they're trying to imagine how this might work in their organization. So there's some pretty specific questions that we might get to Cheryl to help these folks start to build a program similarly in their organizations.
Sure thing. Let's talk about what your experience has been with financial well-being vendors. Have you seen anyone that's particularly successful?
We have only used, SmartDollar was our pilot, and so I don't have experience with others at this point. We definitely know there's a need. Financial well-being is a very real thing. People do want information, and so for us, we're going to move forward with SmartDollar on a larger pilot basis, but, it's very possible that in the coming years we may do a side-by-side and put a couple out there and see which one sticks.
That plays into the next question, Cheryl, which is it sounds like you're doing a number of pilots. How do you decide when to move beyond pilot and fully roll out a program?
It's a couple things. One is, the results. You definitely want to know that the results are there. All of these things, they all come at a cost. It's an investment, so you have to see, are you seeing the results that were promised when the, that sales team came here for that initial meeting? But beyond that, it's also what employees really engage in. What have they taken away from it? So, it's not always about the numbers. It's a combination. And so it's also about what employees have, what are they engaging in? What are they interested in? How quickly did the pilot fill up, or did we have to kind of keep reminding people that the pilot was available? So it's a combination of those kinds of things.
Excellent. Okay. What methods did you use to promote the telemedicine to increase it to 400?
We did nothing more than it was on the platform, and when you logged in as a wellness participant into the LIMEADE platform, it was one of the first items that kind of was served up. There are tiles that appear, and it was a tile that appeared to employees, and they got some points for registration. And so that was really the extent of it. And I don't recall the exact number of points that they got, but generally we don't, for those kinds of things, it's not more than maybe 25 points or so. So it wasn't, this huge number of points that it was really just, I think, it was a reminder that it existed and an opportunity to take action and register.
Okay, thank you. Does Kindred provide all employees access to their wellness program, and what about dependents?
So today, Kindred provides access if you are enrolled in our medical program. It is access to the program is available to you and your covered spouse. It's not available to dependent children at this point, and it's not available today for those who are not participating in the medical program. However, it's certainly something that I think, we've had multiple conversations with LIMEADE about expanding it to the entire employee population. We talked about it a few times very recently again, and it's something that we definitely want to look into. I think it's something that all employees could find value in. We just haven't made that move just yet.
Yeah, and I think that's why we're talking about it, right? Because as we elevate the conversation to looking at things that are outside of just benefits cost containment, but things like, are we helping to build a great company and a great culture? Are we helping to reduce turnover and increase employee engagement? Are we helping to drive patient care satisfaction? then you start to say, well, we should be authentically investing in everybody, or at least making them feel like that. And so I think that's why those conversations are happening, and we've seen some really great examples of other organizations doing that as well. So great question. There were about 3 other questions related to that, questions around, hey, if your incentives are all about, premium reduction, how do you engage folks who aren't on your benefits? How do you get some of those people who aren't participating because of the incentives to participate more, et cetera? So I think those are really great questions. I think we're working with Kindred on that, and I can tell you a lot of it has to do with giving people a program that they use because they want to, not because they have to. Having them have the ability to find things that are really meaningful to them, regardless of what it is that they're working on. Discover some things about themselves that maybe they didn't know in a positive, not a punitive way, and be able to connect with their social networks and peers around those things in, frankly, a way that a dispersed organization wouldn't be able to do. So if you're trying to, eat healthier when you're on site and somebody else, a state away is trying to do the same thing, you can collaborate together and motivate each other and learn from each other, et cetera. And I think those things tend to be more important to people than, a gift card. So I think there's a lot of room there for some really cool innovation in the future.
Thanks, Stephen. The next question is, how do you engage the hardest to reach employees, the ones working at home or in their car, for example?
It is always a challenge when you have an organization that's built like ours. We're so dispersed, and it can prove difficult. But luckily, the platform is available, whether you're at your desk, any mobile device, and then there's an app that's available as well. And so, really anywhere you are, it's right at your fingertips. And with those, whether it's the local activities that we can build in, or that make people kind of feel part of the bigger thing, those team challenges, or just the coaching, or just going in and, signing up for the various activities that are just out there and available to all employees. It really helps, just the fact that it's so readily available to them.
What are you using to measure how habits are formed? Mind, body, work, social. Is this data pulled from the HRA?
It is. I think it's a combination. It's definitely with the well-being assessment. There's definitely all the dimensions that go into play there, where we can kind of take a look, especially at things that go beyond the physical, right? Because we do have the biometric screening that can tell you a lot about physical health, but then we do rely on the WBA to determine that. And another thing that we've used is just simply, which activities are people gravitating towards, and what they're finding important to them. And if the well-being assessment may show that they feel stressed, they don't, maybe their job satisfaction, do they feel supported at work, things like that. But then beyond that, you can also look at, what are they gravitating towards as far as activities that they want to take part in, and maybe it's that unplug and that me time and things like that you can really figure out where someone's mind is and their state of mind.
Something that's coming up for LIMEADE users is actually, hey, it's hard to measure whether or not we're improving our habits and improving our well-being if we only measure it once a year or less often. And in fact, I hear a lot of customers talking about, hey, we don't really want to do biometric screening every year. We don't really feel like we need to do that. But we do want some other way to check in with people on a, frankly, way more regular basis. In fact, I would argue that most of the other functions of HR have also started to figure that out. In performance management, we don't just do once-a-year performance reviews anymore. In fact, great performance management happens every day. Learning, we don't just do, big hour-long sessions, but we're trying to deliver bite-sized learning for people in the moment when they need it. I think, well-being really needs to follow suit there, and we need to be able to figure out how to check in with people on a regular basis around how they're doing with things like, emotional, physical, financial, and work well-being. LIMEADE has a tool for that we call LIMEADE Daily, but I think if you think through your processes and think about how you connect and interact with your employees more to check in and see if they're building those habits and redirect them when they're not and celebrate them when they are, I think you'll see more frequent participation and a feeling of personalization in your programs too.
Okay, well, we're going to have to leave it there because we're at the end of our time. So thank you very much, Stephen and Cheryl, for your great presentation, and thank all of you who joined us today and for your good questions. We hope to see you on another Employee Benefit News web seminar in the near future. Have a great rest of the day and be well.
Thank
you.
Bye,
everyone.